What's up, ADHD crew? Today I'm going to try and answer a very commonly asked question, and that is, does ADHD get better with age or does it get worse? There's a massive misconception about this, and a lot of adults who believe that ADHD is not real often frequently believe, well, okay, they're just going to grow out of it. My experience with ADHD is kind of interesting to me because I can see the transition in how I've changed from childhood to adulthood. As a child, I was very much introverted, very quiet in my own little bubble, and I was extremely inattentive. I would also get into a lot of trouble unintentionally because of my lack of attention. So I'd miss instructions, and I would cause a lot of confusion for myself simply because I wasn't able to really absorb everything going on. But I noticed as I got older, I transitioned into my teens, especially my late teens, I started to get more hyperactive, it seemed. And I don't know if that's because perhaps I just became more confident and I just had more confidence to express myself, so it appeared as though I was more hyperactive, or whether there was some actual physical changes in my brain altogether. The adolescence is a very turbulent time, and I think a lot of the influence on ADHD is going to come through the hormone aspect, especially aggression, testosterone, rebellion, and just things like indulging in alcohol. That definitely brought out the impulsivity in me, and I really noticed it getting worse through that. But now that I'm 30, I know exactly the way I work, I understand myself, but that's only because I've had a diagnosis. And as a result, I have developed very good strategies and self-reflection techniques in order to really change and improve myself and adapt to the flaws that I have.
Years ago, people used to believe that ADHD just went away when you got to be about 12 or 14 years old. And the reason for that is that often those who are hyperactive tend to get less hyperactive as they get a little bit older. Most of the people who are diagnosed in early childhood with ADHD continue to have at least some symptoms.
ADHD is typically a chronic disorder, meaning that most children, around 50 to 80% with ADHD, continue to meet criteria for the diagnosis as they move into adolescence, and around 35 to 65% continue to meet criteria as adults. Further, only a small number, around 10 to 20% of children with ADHD, will have no symptoms or impairment as adults. In other words, relatively few people appear to fully outgrow ADHD in adulthood. And I think there's a lot of truth in that, because even though I can see improvements, it's still there. I know when my ADHD is coming to the surface, if you like. And I will say that considering that I've nailed down a great strategy and I understand myself, I've got a dose of medication that works for me nicely, and I take care of myself in general, I would say overall my ADHD symptoms are very well managed, so you'd be really surprised how much you can reduce the appearance of ADHD when you involve a lot of self-awareness, introspection, and you just got a really good daily routine. But I know that it's not gone, and I notice that it really comes out when I'm stressed. When life is going smoothly, I'm great, but during times of difficulty, the overwhelm crops up, the emotional dysregulation comes back, the low frustration tolerance is definitely there still, and it can be hard even to this day to shut external distractions out. It is possible for it to appear to get worse with age, but this is usually mitigated by lifestyle habits and circumstances. A person who hasn't had an effective treatment will probably have a poorly managed life, which would lead to irregular sleep patterns, poor nutrition, and uncontrolled stress, which will obviously make symptoms worse. It also might appear that ADHD could be worse in old age simply because the brain naturally starts to decline. And in fact, with each decade that passes, it's shown that dopamine production decreases by around 10%, which could explain feelings of worsened ADHD, although this is not likely to happen till at least in your 60s or 70s. A 7-year follow-up study quotes, "Despite the stage of brain maturation in adults suggests stability, approximately 1/3 of the sample did not keep full DSM-4 diagnosis at follow-up, regardless if at early, middle, or older adulthood. Although full remission is less common in childhood, it should still be considered as a possible outcome among adults." So this is the idea of what's called a persister and a remitter. In one study dating back to the 90s, there was a report that hyperactivity and impulsivity symptoms tend to decline at a higher rate than inattention symptoms. So this is why it can be confusing. It'll appear to the outside observer that the ADHD has gone, but what's actually happened is the hyperactive element has simmered down, and instead of being sort of outwardly hyperactive, you'll just be more restless, right? You'll have racing thoughts, probably prone to insomnia, and just perhaps making impulse decisions or having a bad spending habit. So the hyperactivity actually just changes into a very subtle form. Another study quotes, "A second model postulates that remission is driven by the recruitment of new brain systems that compensate for ADHD symptoms." So the brain is actually adapting to ADHD. You're actually getting better with age in a way because it's like a self-preservation method, right? So what makes you persist with ADHD is all down to your genetics, your environment, your level of self-awareness, and the overall lifestyle adjustments that you make to correct your behavior. According to Psychology Today, young adults who have been previously diagnosed with ADHD in adolescence but no longer demonstrated clinically significant symptoms still had smaller than average caudate nuclei than people without a history of ADHD. So from the research I've seen, basically you don't have to meet the diagnostic criteria to have ADHD, and this is why it can be such a pain to get diagnosed. A lot of people who grow up have never really had that hyperactive element, such as myself, and it's a lot harder to diagnose. So depending where you live in the world or who you're seeing, there can be a lot of bias that gets in the way, and also it can be difficult to really match you up with that criteria. Hence, having inattentive ADHD is often diagnosed as depression and anxiety, even though they do come comorbidly. You'd have to have a brain scan in order to determine if you physically have ADHD, because it's a structural condition, as shown by another study that claims that most children with ADHD will remit by age 18, but impairment remains. Overall, it's really unknown at this stage. There's not enough studies and it's kind of confusing. I know for a fact that I persisted, but I have remitted at the same time, so I think it's a bit of both. I think most people get better overall, but they still persist. So there we have it. It just has the potential to improve, basically.